This graph is illustrating the relationship between plasma calcium concentration and the secretion of the two hormones, the parathyroid hormone and the calcitonin. On the x-axis, there is plasma calcium concentration that is expressed in milligram per 100 ml, and this normal calcium is marked at 9.4 milligram per 100 ml. On the y-axis, on the left side, this red curves, they are the parathyroid hormone level in the nanogram per ml, and on the right side, y-axis is showing the plasma calcitonin in the picogram per ml. The parathyroid hormone curve is showing a steep decrease as the plasma calcium level is rising. As you can see, this acute effect, a slight drop in the calcium causes a sharp rise in on the this left side of the graph. A slight decrease in the plasma calcium concentration will result in sharp rise in the parathyroid hormone, while in the chronic effect, the long-term calcium deficiency lead to gland hypertrophy and even greater parathyroid hormone secretion. Parathyroid hormone secretion is high when calcium is low and nearly zero when calcium exceeds 10 milligram per 100 ml. While this blue curve is showing the calcitonin, and here the calcitonin increases as the plasma calcium rises, and this calcitonin responds to high calcium by promoting calcium storage in the bone. Secretion becomes notable when the calcium exceeds even more, and it level exceeds the normal level. Then this graph is also highlighting the inverse regulation of parathyroid hormone and direct regulation of the calcitonin by the calcium. That means that low calcium will increase the parathyroid hormone, that is the dominant hormone. So this is inverse relation, while high calcium will directly increase the calcitonin secretion. This response is usually weaker, especially in adults. A small calcium shifts just a few percent will lead to dramatic hormone response, especially for the parathyroid hormone. So this table is comparing both of the hormone, the calcitonin and parathyroid hormone. The calcitonin stimulus is high calcium, while the stimulus for parathyroid hormone is low calcium. The calcitonin is secreted by C cells, while the parathyroid hormone is secreted by chief cells. The gland for parathyroid is parathyroid hormone, parathyroid gland, while for the calcitonin they are secreted from thyroid gland. The effect on the calcium of calcitonin is decrease in the calcium level, while the parathyroid hormone increases the level of the calcium in the plasma. While on the bone, the calcitonin inhibit the osteoclastic activity, while the parathyroid hormone stimulates the osteoclastic activity, and both are regulated by negative feedback loop. The response of the calcitonin in human is weak to moderate, while in the parathyroid case, the response is strong, and this is the primary regulator of the calcium concentration, low calcium concentration. The primary effect of injection of calcitonin within minutes immediately, it is decrease in serum calcium concentration. Uh, this is an immediate response that occur within minutes to hours, and it inhibits the osteoclastic activity, possibly reduces the osteolytic membrane pump, and this lead to balance of the activity toward the deposition of the calcium into the bone. This mechanism is especially active in young animals due to high bone turnover. Then there is a prolonged effect that occurs within days, and there is a reduced formation of new osteoclast, and also these reduced osteoclastic activity will result in decreased osteoblastic activity. As a result, within few hours to days, there will be decrease or reduced bone turnover. Both the osteoclastic and osteoblastic activities are reduced. In human, this effect is short-lived or transient. So there are minor role in other organs also. In kidneys, there is decrease in calcium and phosphate reabsorption, and in intestine there is a decreased absorption of calcium and phosphate. This is insignificant, in especially in human. So the calcitonin has a weak effect on plasma calcium concentration in adult. Why this phenomenon occur? Because this activity of the calcitonin is overridden by parathyroid hormone feedback mechanism, and the calcitonin reduces the plasma calcium. So this trigger the increased parathyroid hormone release, as there is this parathyroid hormone. Parathyroid gland is very much sensitive about the fluctuation in the calcium. So there is immediately increased parathyroid hormone secretion. And parathyroid hormone overrides calcitonin by increasing the bone resorption, renal calcium reabsorption, and intestinal absorption via vitamin D. And hence the parathyroid hormone restores calcium level, nullifying the calcitonin effect. So in adult, the bone remodeling is slow as compared to the children. So calcium flux is small, so there is low daily turnover, even if calcitonin slows the bone resorption. So the net calcium shift is minimal, and in children there is rapid growth of the bone and remodeling, and the daily turnover is 5 to 10 times higher than in the adults. So calcitonin effectively dampens the osteoclastic activity, and it is more effective in diseases with high bone turnover, such as Paget's disease. So total extracellular fluid calcium is in the body is 1 gram, and dietary intake is about zero point 0.3 gram per hour, and in diarrhea there is a loss of many grams per hour from the body, and if the dietary intake is more, it will lead to hypercalcemia, and if there is loss, this increased loss through diarrhea specifically, this will may result in hypocalcemia. So there are risks of hypo and hypercalcemia, and a zero point 0.3 gram change in this is potentially dangerous. So before hormone like parathyroid hormone or calcitonin they respond, there is exchangeable uh, calcium that is present in the bone, and this acts as a buffer function, and it absorbs or releases calcium rapidly into the extracellular fluid and maintain the stable calcium level. Then there is hormonal backup system. If there is this imbalance persists, the hormonal feedback kicks in. So there is parathyroid hormone that increases blood calcium by resorption of the bone, and renal calcium absorption uh, by activation of the vitamin D that increases the intestinal absorption of calcium. The calcitonin is less important in adult, but it opposes parathyroid hormone and inhibits the osteoclast. So exchangeable bone calcium, it provides this exchangeable bone calcium, it provides rapid buffering, and hormone fine tunes and stabilizes the long term levels. Exchangeable calcium in bone plays a crucial role in stabilizing extracellular calcium level uh, before the hormonal mechanism like parathyroid or calcitonin even they kick in. So this extracellular calcium or exchangeable calcium, it is composed of mainly amorphous calcium that are phosphate compounds and other, and especially the CaHPO4, that is about 1%, 0.5 to 1% of extracellular calcium, that is 5 to 10 gram. So there is this is loosely bound in the bone and is reversible in equilibrium with plasma calcium and phosphate, and it represents 0.5 to 1% of the extracellular calcium, that is about 5 to 10 gram. And this whenever there is increase in plasma calcium concentration and phosphate concentration, there is a rapid deposition of the calcium phosphate into the bone. And if there is decrease in plasma calcium and phosphate, there is a rapid release of this CaHPO4 uh, compound into the extracellular fluid. This process is very fast, and it is due to extremely tiny amorphous crystals that have got a large surface area of about 1 acre, and there and also it is influenced by high blood flow through the bone, because about 5% of the cardiac output goes to the bone. About 1% of the extracellular fluid per minute interacts with the bone, and 50% of the extra excess calcium in the blood can be buffered by bone within 70 minutes. There is additional buffer system, that is the presence of mitochondrial buffer system. Many mitochondria, especially in liver and intestine, they contain exchangeable calcium, that is around 10 gram total, and serve as a secondary buffer to calcium homeostasis. So these rapid buffer system prevent dangerous fluctuation in the calcium level, that is the hypercalcemia or hypocalcemia, before hormonal feedback loops, the parathyroid, vitamin D, and calcitonin are activated. The buffering was the first line of the defense. Now, the second line of the defense is the hormonal response. As the first line of the defense, the bone buffering, it kicks in. Hormonal response begins within 3 to 5 minutes uh, after calcium level changes. When the calcium level rises, there is parathyroid hormone secretion that is very quick, and it reduces the bone resorption and reduces renal calcium reabsorption. It also decreases the conversion of vitamin D into its active form, and increase calcitonin secretion is also there along with this within 3 to 5 minutes. So it is this increased calcitonin system is especially effective in younger individual where the bone turnover is high, and it promotes the calcium deposition in the bone and help uh, rapidly restoring the normal calcium level. When calcium level falls, such as decreased dietary intake, the parathyroid secretion increases, and this parathyroid increase in the parathyroid will stimulate the resorption from the bone of the calcium to release the calcium and increase the renal resorption of the calcium also, and promote the formation of 125 dihydroxycholecalciferol that then increases the intestinal absorption.